Good evening, everyone. Welcome to the first edition of 2022 for the Health, Environment, Social Services Committee meeting of Community Board 2. Really excited to have you here, and we have a very busy agenda tonight. I'm going to go through some notices, so please bear with me for 1 second as we get started. First of all, I wanted to let you know that this meeting is being recorded. It's for the purpose of public access and archiving in accordance with the New York State Open Meetings Law. It's the practice of Community Board 2 to conduct remote meetings with all committee members' cameras on. Public attendees are also encouraged to leave their cameras on, particularly if you're given the floor to speak. All attendees, please keep your microphone muted when you are not speaking. To maintain an appropriate discussion and voting process, I will make it known when and which topics are open for comment by committee members, board members at large, and the general public. If you have questions that fall outside of public comment time, please type your questions in the chat panel and we will address them as time permits. You may also email the district office at any time outside of these meetings. We are committed to providing access for all of our neighbors, regardless of physical ability or limitation. If you require accommodation or assistance for full participation, please contact the district office 72 hours before any public meeting. We also ask that anyone speaking or presenting use plain language, speak in a moderate tone, and frequently ask if you're speaking loud enough. If presenting, read the title of every slide and describe any images or on the slide, such as photos, graphs, and charts. Finally, just want you to know that it's the practice of this committee to enforce the concept of respect throughout the entire meetings, every meeting that we hold. So whether you're a committee member, a member of the public, a presenter, or somebody who's here with a liquor license application, it's the expectation of me and this committee that you be respectful of anyone else, and I will do the same. Anyone who's not being respectful, I will ask the board office to remove you from the meeting. I further ask everybody to try to speak in as concise a manner as possible so that we can get through the meeting in an orderly fashion. At this point, I'm going to ask each of the committee members in attendance to introduce themselves. There may be some other committee members who join us a little bit later, and I'll try to give them an opportunity to introduce themselves as time allots. First, Nicole, would you like to introduce yourself?
Good afternoon. I'm saying afternoon. Good evening, everyone. I'm Nicole McKnight, board member.
Thank you, Nicole. And we're also very excited to have you as the vice chair of our committee. Jessica?
Thanks, Brandon. Hi, everyone. I'm Jessica Thurston. I'm the secretary of both this committee and the full board.
Thank you. Let's see. Barry, would you like to introduce yourself?
Sure. Hi, good evening, everybody. I'm Barry Newmark, and I'm a public member of the committee.
Great. Monique?
Good evening. My name is Monique Cumberbatch. I am a board member and committee member.
Okay, Alejandro.
Alejandro Varela, public member of HESS.
Thank you. On my count, that's 5 people, so I think we may need one more for quorum, but we can still get going with some of the preliminary items of our meeting. Very honored also, I see we have board members Betty Flatbush, Bill Flanoy, and Latrell Masso here. Thank you very much for joining our meeting. With this, I'm going to move along a little bit in the agenda. We'll have to pick up the approval of the agenda once we have someone else join.
We actually have 6, Brandon.
We
So
do?
we could, yeah.
Thanks for counting. I appreciate that. In that case, we'll stick with the agenda. Could I get a motion with respect to the agenda?
Motion to approve.
Motion from Jessica, second from Barry. If anybody does not approve of the agenda, could you please say so now? I'll take that to everyone approves of the agenda. Minutes from December 1st, 2021. Hopefully everyone's had a chance to read them. They have been circulated. Anyone want to make a motion on the minutes from December 2021? Nicole?
Yes.
We have a motion to approve from Nicole. I'll second the motion. Any discussion, edits, corrections that haven't already been provided? Hearing none, if there's anybody who does not approve of the minutes, please say so now. We'll otherwise consider them unanimously approved, or anyone who wants to abstain. Okay, minutes from December 2021 are approved. Next up on the agenda tonight, we have our regular COVID-19 presentation from committee member Barry Newmark. Barry, I've got you on the clock for 5 minutes, and the floor is yours.
Thank you, Brandon. And the news that everybody has been reading about and hearing about with regard to the Omicron variant and the impact that's had on the number of cases throughout our country and in many parts of the world is happening right here in beautiful downtown Brooklyn, as we know it. In the past 7 days, the new cases that have come up per 100,000 people have grown from between 14 times and 20 times the usual monthly report. For example, last month, I reported that there were 149 new cases in 3 of our neighborhoods in the previous 7 days. This month, there are 2,189 new cases in the past 7 months in each of 3 of our neighborhoods. In 3 other neighborhoods, the multiplier is more like 20. For example, 144 became 2,857. 230 became 2,494. And 210 became 3,215. So that is probably not surprising, but still took my breath away to actually see it on paper. Of course, the total number of cases in our community has grown as well as a result of all of this. So that right now, whereas I used to say that all of our neighborhoods are below the Brooklyn rate per 100,000 population and below the New York City rate, I am sorry to say that every part of our neighborhood, every part of our community is now higher than the Brooklyn rate and higher than the New York City rate. Our rate ranges from 16,276 up per 100,000 up to 21,302. So we are unfortunately not doing very well in the number of new cases that are developing compared to the rest of Brooklyn and the rest of the city. On the positive side, we've had very few deaths, thankfully, and our death rate per 100,000 continues to be considerably lower than that of Brooklyn and that of New York City. The vaccination rate has increased in each of our areas that I've been reporting on, but as I've been unfortunately consistently having to report, there are 3 neighborhoods in which the vaccination rate, at least of 1 dose, continues to be lower than Brooklyn's and New York City's. And those 3 areas are Fort Greene, Bed-Stuy, Clinton Hill, Williamsburg South, East, and North. Yeah, so those are the 3 areas that the rate continues to be pretty low. For example, in downtown Brooklyn, Dumbo, Brooklyn Heights, the vaccination rate for the first dose is 98% of eligible people. It's 83% in Bohemien Hill, and it's 91 over a little bit over 91% in Clinton Hill and Prospect Heights. So those are the highlights of our local area. Of note is, if I can just talk about something that I don't usually report on, I happened to, in going through all of this, find this really great article from the New York Times online that I can send to the board office along with my spreadsheet in case anybody wants any of this. And it's about the intensive care unit occupancy rate in New York State. I don't know, some of you may have seen this. And this is as of December 30th. So it only doesn't even really include what may have been the aftermath of Christmas, let alone New Year's Eve. So we'll, can only wait to see what happens down the road. But as of December 30th, the United States occupancy rate of ICU, of intensive care units, has been 77%. And in New York State, it's 72% on average. But in hospitals in Brooklyn, we range from a low of 62% at Maimonides to a high of, believe it or not, 99% in Interfaith and Woodhull. Other local areas, Brooklyn Hospital is at 74%, Kings County is at 80%, New York Presbyterian Methodist is 88%, Wyckoff is 88%, Coney Island Hospital is 86%, New York Community Hospital is 77%, and Brookdale is 87%. Just to tell you about some hospitals in Manhattan that might or might not be relevant for some people if they feel they need to go to the hospital. NYU Langone is a low of 67%. Lenox Hill is even lower at 64%. And then you get up to parts of Mount Sinai, 3 different areas. One is at 83%, one is at 88%, and one is at 93%. Memorial's at 86%, and Metropolitan's at 71%. So they're not doing that much better than our Brooklyn hospitals. And, once the Department of Health gets on, we can talk some more specifically because there've been some really great articles in the Times today. In fact, there was a front page article that went into some explanation about why there are greater numbers of hospitalizations and what that's all about. But I will leave that for the experts. And if we have any questions or comments for them, we could bring that up then. But as always, I welcome any questions that any of you guys may have.
Thanks, Barry. And thank you for being so diligent about giving us these updates every month. I'm going to move to the Department of Health presentation, and then we can take questions and answers on both subjects at the conclusion of that. So we're very honored to have Simbo Ije. Is that the correct way to pronounce it?
Almost.
Sorry.
The G is strong, is Ige.
Ige, got you. Well, thank you very much for coming. We're honored to have you here, and really looking forward to your presentation. As you can tell, our committee is very into the numbers, and we've been very focused predominantly on our districts of 11201, 11205, and just looking at the numbers today, the vaccination rate in 11201, a neighboring zip to 11205, is 87% for fully vaccinated versus 52%, which is 11205. And I think one thing that we've spent a lot of time getting into as a committee has been granular health statistics. And I get requests from people who are very interested in granular health statistics. So I think hopefully we can talk about that a bit with your presentation, but I'll let you take it from here. Thank you very much for joining us.
Thank you. I am Dr. Simbo Ige. I am the Assistant Commissioner for the Bureau of Health Equity Capacity Building. And I also lead the community engagement for the COVID-19 response. And I'm here with my colleague, Chelsea Cipriano. Chelsea?
Hey, hello, everyone.
Right.
Yeah, hi. Hi, everyone. I'm Chelsea Cipriano. I'm the Executive Director of Intergovernmental Affairs for the Health Department. And like many of us here at the Health Department, have held many roles and worn many hats. I believe I've spoken to maybe some of you in various capacities on reopening guidelines, and then also as a member of the city's Vaccine Command Center. So between Simbo and I, we can really hopefully answer most of your questions or tell you where to get the right information. Dr. Ige won't say this about herself. She is a physician who has done the lion's share of a lot of our community-based conversations, particularly with folks who are not so sure about getting vaccinated, which even as we have super high rates of vaccination across the city right now, Dr. Ige and her team have really done such great work to continue to encourage folks who still have questions, who still need those questions answered in a thoughtful and respectful way, as we really encourage as many New Yorkers to get vaccinated as possible. I think we are, thank you so much, Barry, and really good to hear, Brandon, that folks are, we call ourselves lovingly, data nerds, because that's what we are, those of us on the health side, because we really want the data to drive the interventions and the prevention that we're taking. And we are worried, right? Right now, the cases that we're seeing are so high, and we are seeing hospitalizations increase as well. But we also know what we need to do. And here in New York, people are responding in kind by putting those masks back on. I know folks got a little comfortable, may have taken them off for a while, but people still are wearing their masks, particularly as we look to compare ourselves with other parts of the country. Very grateful for people's willingness to wear masks. We are getting vaccinated boosters. If folks didn't see, there was some recent news out of the FDA and CDC expanding booster availability and approval for younger people. That hasn't received full CDC approval yet, but we're waiting anxiously for that. So if anyone on here is listening and hasn't gotten their booster yet, and they are 6 months out from their mRNA vaccine, Moderna or Pfizer, and 2 months out from their J&J, go get the booster. It is so critical right now, particularly when it comes to preventing hospitalizations, that we get our community boosted, that we wear masks, that we test, particularly before and after big gatherings. And I'm probably saying things that you all know already, but they're important repeating, because they're the tools that we have to keep ourselves and our communities safe. I do want to call attention, Barry, clearly you all are very deep in the data on our website. And it's linked here in the chat, so thank you to whomever dropped it in there. I think our data pages are constantly evolving. We're trying to add more as much as we can. Recently added more information about boosters. Been getting a lot of questions about booster shots, and the number of folks who have received boosters or third doses, that's now captured on our data pages. And also, one cool thing that a lot of folks don't know, or maybe don't take advantage of, you can download the data yourself from our website, and maybe you all know that already, but there are little tags under each of the diagrams that say get the data, and if you click that, it's a click, and then you might get some like crazy numbers on your screen. If you right click that, it saves as an Excel document, and you can kind of navigate the data, the more raw data, if you will, on your own. So I always like to tell folks that if they don't know. And then finally, while Dr. Ige is talking, I'll just drop some resources from our website that may be a little buried and folks haven't seen, so that everyone knows that they're there. One thing, the biggest question that I've been getting all week is about what to do if you test positive using an at-home test, since that may not be through the normal testing infrastructure where you walk into a doctor's office or a testing van or a hospital and get the test and then get your result in a phone call from Test and Trace. We have a document that explains what to do. The 3 easy things to remember are: 1, isolate immediately; 2, ensure that you have the resources you need to safely isolate by calling 212 COVID-19. That's where you can get a hotel, food, free dog walker, a at-home resource kit with a pulse ox mailed to you. And 3, for folks that you've been in contact with recently, close contact in particular, let them know that they should get tested immediately, particularly if they're having symptoms, but immediately. So I will drop that link in the chat, because it's something that I've been asked for a lot these days. And we are just really trying to help folks understand, with the influx of people using home testing kits, what they need to do if they do test positive at home. Okay, that was a long spiel, but I will pass it to you, Dr. Ige. I know you're just trying to introduce me, but thank you for letting me start off.
Right. I was just texting with Chelsea to say that we probably won't need to do a presentation with this group, because they are data nerds. I mean, you seem to be on top of the situation and you have all the numbers correct and everything. So today what I will do is I want to give you a quick snapshot of the key things we're looking at with the COVID situation. You know where the data is, but I want to show you quickly a few important things to keep an eye on the website. I am showing you the data straight from the website so that as it's updated, you can have it instead of a PowerPoint that will be, you know, out of date in a couple of days based on how things change with COVID. So we know that cases are increasing. You shared that data when we started. This is what, you know, the graph looks like for the city in the last couple of months. You look at how it's just been a remarkable spike in the number of cases in the last few months. And if we look at hospitalization, we see also a similar spike, but there is reason to be hopeful. You can see that downward trend in the last couple of days. And when we look at death, we see that spike as well, but not as dramatic as cases and hospitalization. And we're beginning to see that drop off a little. So we are holding out hope. We know better than to, you know, say that, oh, we're over the peak. This virus has humbled all of us time and over and again. But we are optimistically looking at the trends and hoping that the holiday spike, maybe we are, you know, really in the days of looking at a downward decline in the next few weeks. Another thing that I want to highlight for you is, yes, there is a spike in cases. Yes, there's a spike in hospitalization, and there is a spike in the number of people dying from COVID, again, because of Omicron, as you can all imagine. But again, this is a chart that shows how worried should you be if you're vaccinated compared to if you're not vaccinated. The reason why we continue to message around vaccines is because of this data. If you look at this chart, there is a purple line and there is an orange line. The purple line is those who are not vaccinated and the orange line is those who are vaccinated. So as you can see, cases have skyrocketed. There's been a remarkable upward trend in the last, from the late November till now. But as you can see, that purple line, a lot of people who are not vaccinated are getting sick. There are more people getting sick who are vaccinated, but you can see the orange line. It is not as dramatic an incline as it is for those who are not vaccinated. So we continue to message around vaccination as one of the most important tools to keep COVID at bay. And the same, you will see the same trend for hospitalization. More hospitalization is happening among those who are not vaccinated. Those who are not vaccinated, there is increasing hospitalization, but not as much as you see among those who are not vaccinated. And it is the same for death. So we continue to message that the vaccine is an important way to protect yourself from getting sick, from getting hospitalized, and from dying from the virus. So those are two things that I want you to see. Again, this data is updated on the website, so you can get a sense of what is happening on a daily basis. So I am going to stop there and talk a little about what is our goal now with Omicron. There is a pandemic. And as long as transmission continues, there is a possibility that we will continue to have variants. So what is the end goal? What is the end game? That's the question people ask all the time. So what do we do? There are three goals that we are aiming for. One, the ultimate goal is to stop transmission. Stop this virus from person to person. The second is to stop people from getting severely sick with the virus. And the third goal is to stop people from dying from the virus. We are doing a pretty good job with all three based on the tools that we have. Those three are the goals. So every time we measure our success by death rate, hospitalization rate, and case rate. Now, how do we stop these three things from happening? One, we can stop people from getting sick at all. That's called primary prevention. The way to stop people from getting sick at all is, one, to stop the virus from transmitting from person to person by wearing a mask. If I'm sick and I'm wearing a mask, and this is a respiratory virus, it is transmitted through talking, through eating, through singing. Every time you open your mouth or your nose or you breathe in or out, the virus can escape and it can transfer to another person. So when you wear a mask, you limit the opportunities for the virus to transfer from person to person. So as long as people are wearing their mask, we're limiting the opportunities for the virus to move around. So that's one way. The other way is the social distancing. This virus doesn't travel very far because it is a droplet for the most part. Some pieces of it can be aerosolized, but is mostly transmitted through droplet infection. That is, it is suspended in tiny specks of saliva. So if you can stay far enough away from the person, even if some specks escape, it cannot travel very far. So social distancing is one way to stop infection from happening. Then you can protect the individual such that if they come into contact with the virus cannot penetrate and take over. That's what vaccination does. So we have masking, we have social distancing, we have vaccination, we have hand washing. Now, the virus can escape when someone is talking. It can then settle on a surface and you can touch that surface and then touch your face. And then you can get the virus that way. If you wash your hands all the time and you avoid touching your face, that's also a strategy. Now, we are in winter and we always say, layer your protection. You layer your clothing in winter. You don't go and say, you know what, I'm just going to wear this heavy jacket and that's all. And it's the same with COVID. All of these strategies are important to keep people safe. So not one or the other, it is everything. So we don't want to underestimate the importance of any of these core strategies: masking, social distancing, vaccination, and hand washing. Also staying home when you're sick. So that's the primary prevention strategy. So we're doing a lot of education around that to help people understand this is how to stay safe and protect yourself from the virus. Now, in a situation where all of this fails and the virus has had a chance to get into the individual for whatever reason. Now, this person is sick with the virus. Now, there is the secondary prevention. We don't want this person to get so sick that they die from the virus. So what do we do at that stage? We want people to get tested as quickly as possible so that they can take appropriate treatment and take appropriate steps to prevent transmission. So testing becomes important at that level. Number two is making available the treatment option. So we have monoclonal antibodies, and then now we have oral antivirals. So that if you're sick and you're likely to become very sick and have high risk factors for severe illness, you can get treated quickly and we can nip that in the bud as quickly as we can. So all of that is also ongoing. We have monoclonal antibodies available and we're messaging around this. And now we also have oral antivirals available in the city. And that is also helping to prevent, hospitalization and death. These are the core strategies and the core tools available to us at the moment. Of course, when the person becomes sick and then becomes hospitalized in spite of all of this, then there is the treatment at the hospital level. And we're doing everything we can to ensure that folks are also getting appropriate, good quality treatment at that level. There is a push now to get more staff into hospitals, to stop the staff of the hospital to handle the surge, to ensure that anyone who's so sick that they have to be hospitalized get appropriate care, and we limit the opportunities for people to succumb to this virus. Now, this is a virus that has taken the lives of, almost 1 million people in the United States at the moment. And so it is not trivial. it is important that we mobilize every tool in our toolbox, and it's important that people understand the risk associated with this virus. So those are the strategies that we have. Now, the question is, how do we convince people that, one, there is risk still present, two, to adopt all of these tools that we have available, three, to believe the updates and the changes that we're making as the situations evolve. Now, these are the core areas for us in community engagement. How do we get information out to people that there is risk? The average person walking on the street does not always believe that I am at risk of COVID. So how do we convince people that there is a risk out there? Then how do we convince people to take the appropriate precautions to keep themselves safe? And then finally, how do we encourage people, if they fall sick, to get treatment and do all of the other things that we need to stop transmission? So that's our role at Department of Health, the community education, working with community-based organizations, faith-based leaders, elected officials to get information out to everyone, and then also ensuring equity, that there is no disproportionate impact of this virus on any one group over another, and ensuring that whatever the barriers are that limit access to resources, we're doing our best to eliminate those barriers. So I will stop there. That's a little overview of the situation, what we're doing to address the situation. And I know you have a ton of questions already, and I will do my best to answer. But I wanted to provide that little background in terms of where we are, what we want to achieve, the progress we have made to date, and then let you, pitch me whatever questions that you have so I can tailor my answers to your needs.
Oh, well, thank you very much. And thank you for your presentation. It's very comprehensive. Just briefly, before we get into committee member questions, is there anything you can say specific about the disproportionate breakdown between 11201 and 11205? I know that was one of our first points that we wrote to you all about, and what we're really hoping to understand, because I think a lot of us on this call are committed to COVID-19 compliance and vaccines and everything, is really talking to making a difference in a community where there's 52% of the people are not vaccinated, or 52% are vaccinated. And how do we get more granular than just 11205? Because we suspect that there are some parts of 11205 which are much more vaccinated than other parts.
Yes. So in terms of looking at the barriers to vaccination, 11205 is Bed-Stuy, Clinton Hill, Fort Greene, and this is a neighborhood where we have seen cases higher than the Brooklyn case rate and higher than the city rate, and vaccination rates lower. When we have done a lot of work in looking at what drives the vaccination uptake, and it is not a one-size-fits-all. Every group is unique, and the drivers are different. But overall, there are three buckets, in terms of vaccination acceptance, or what we call vaccine confidence. One, there are early adopters. There are people who are eager to go once the vaccine hits the public. You see the long lines. People are eager to, get the vaccines and get vaccinated. So we have a large chunk of people. Usually about 25 to 30% of the population falls within that group of early adopters. And then we have the late adopters, or the category we call the watchful. These are people who want to wait and see. They are not the first to jump on the bus. They want to see other people go first, and they want to be sure they have all the information they need to make a decision. And then we have those who are the absolutely not group. Now, we like to say there is a movable middle, and the movable middle are those who are not sure. And the reason they're not sure or they're watchful fall into three categories. One, people don't have all the information they need to feel like they can make an informed decision. Then two, they are system distrusters, people who have had bad experiences with the system and are therefore more cautious in terms of jumping on the bandwagon. And then there are those who are conspiracy believers. Now, that is the hardest group to move. So in terms of those who are not sure, there is a recent study by the Kaiser Family Foundation that shows that 8 out of 10 people are not sure about one or more of the prevailing misinformation. For example, 8 out of 10 people feel like COVID-related deaths are exaggerated. So there is so much information on the internet. People are bombarded by all kinds of information. They cannot decipher what is true or what is not. So there are those who really don't believe that there is COVID or it's a problem or it's severe or, vaccines work. So addressing the misinformation, getting people information through trusted sources, through providers, through community leaders, etc., is one way to do that. Then we have groups that through historical and continued discrimination and systemic racism and mistreatment and disinvestment have learned to protect themselves by not jumping on everything that is offered to them. Now, communities of color have, because of years of experience with the healthcare system, have a higher level of distrust of the system. And addressing that takes time. Trust in one area builds trust in other areas. If the government didn't show up when people were hungry, or they didn't show up when they needed housing, or they didn't show up when, we don't have grocery stores in our community, or we don't have farmers markets in our community, all of a sudden the government is all over us, waving a vaccine in our face and say this is good for you. They're really suspicious. Like, seriously, now you're interested in us? Like, what is going on? Are you sure this is safe? Are you sure this is legit? Are you sure this is good for us? So how do we message? How do we ensure that people feel like this is safe and this is good and this is truly what we say it is? That is the hard part. And that process takes time. It's not a one-time interaction. It is continued, repeated interaction, but also elevating stories from the community. So people are not just seeing you on the TV saying, oh, it is safe. Like, I don't trust you. So you can say it's safe all you want, but I don't know you, I don't trust you. But if my pastor or my religious leader or my neighbor or my family or friend says, I have taken the vaccine and I am doing okay, it resonates more. People who believe misinformation do not go to the Department of Health to go check it out. They go to their friends and they go to their family and they say, someone said this. So how do we get information through friends, through family, through neighbors, through folks like you, to those who need to hear that this truly works, this truly is safe? That is also another strategy. The last group of people who believe in conspiracy, it is much harder. All of the surveys we have done, we do health opinion survey every quarter. That percentage remains consistent. So there is a small percentage of people, between 10 to 15%, who says, I am not for this vaccine and there's nothing you can do that is going to change my mind. And that is a reality we have to live with. And this is the United States. We like to do what we like to do, and people don't like to be told what to do. So there is a possibility that people are not going to change their minds, and that's where the mandates come in. And in some of those cases, the only thing that will change people's mind is because it is required by the employer, is required by, because they want something, and then they said, okay, I'm going to do it now. So these are a combination of strategies that we're using to move things along. But we need to understand that in certain groups, it will take a longer time for them to get there. And this is why we remain committed that our community engagement work continues regardless of if they're mandates or other strategies that we're using. We're combining all of the strategies, knowing that everyone's why is different, but also helping people to understand there is no magic wand to build trust. You can't build trust overnight. It takes time, it takes commitment, and people need to see that we are consistently there. We are consistently messaging. We are responding to concerns and tailoring our message to the community. So those are the strategies we're using.
Okay, thank you. Questions from members of the committee? Members of the committee?
Brendan.
Mr.
Alejandro here.
Varela, go ahead.
Okay, thank you for the presentation, both of you. This was really great. Dr. Ige, I was curious about what sort of information is available, simplistic information around how vaccines function, around, I'm thinking specifically of at my kids' school, the conversations I have with parents around how they're pro-vaccine, but they don't want to take risks. They don't want their children to be guinea pigs.
Yeah.
And sort of a lack of understanding, I think, that the guinea pigs were the people who participated in the trial, right?
Right.
They did that for us. And I feel like there's a message missing around putting forth, these are the heroes in this, the people who went and did this for us. And I believe there's a lot of people who could be swayed with that, who were like, okay, someone put themselves on the line for us to be able to have this vaccine, and we know it's safe because of that. So that's one part. The other thing I wanted to sort of boost is what you said around the histories of institutional racism and discrimination and the ways the government in the United States has and continues to let down particular communities of color, but other communities as well. And gosh, the way you said it was so perfect. And I really do believe there are people who, if they heard that, if that messaging came from the mayor and from the health department around, we know we have let you down. We know these are the ways in which we haven't been there for you. I think that would also move some people. I guess the problem is if you can't then back it up with economic policy, with sort of reparational policy, that sort of thing, then, it's sort of like, believe us, we so I understand it's tricky, but I do think that is an opportunity. There is an opportunity there, acknowledging past wrongs in order to build that trust.
Right, and you're right. Thank you very much. I'll start with acknowledging past wrong. We have a trauma acknowledgement statement that we use for every presentation that acknowledges the historical and contemporary injustices in communities of color, in the LGBTQ communities, and immigrant populations, and those who have not had the same access to resources and support as others, just as a framing for our community conversations. We have the small group conversations, but we know that we are a department of, how many thousand people. The scope of this pandemic requires more than the Department of Health to get the message out there. So we have a partnership. We have contract with 69 community-based organizations, 18 in your community, in the neighborhoods that are under CB2. We have 8 CBOs that are contracted to work in your neighborhood alone. And the community-based organization have the talking points, even including the clinical trials. For example, for Pfizer, there were at least 40,000 people who participated in the clinical trial. And of this number, at least 10% of them are Black, 25% are Latino. These are people who volunteered to take the vaccine as part of developing a solution to this pandemic. And we also help people understand those numbers. We have it in the CBO talking points, but the CBOs also have funding to tailor the messaging, to develop this messaging and craft it in a way that resonates with their communities. So they have all kinds of fun ways. They have rap music, they have poems, they have, all kinds of shows that they use to communicate this message, to help people feel able to access this information. We also help people understand that beyond the clinical trials, as at today, there are 6 million New Yorkers that have received this vaccine. So even though vaccination coverage among community in Black community is still below the 70% goal, but it is millions of people that have received these vaccines already and are doing well. We know them, they are friends, they are neighbors, they are colleagues. In Department of Health, 98% of staff are vaccinated. So these are real people that we can tell their stories. So we have videos of people from the communities telling their stories. And the CBOs also host community testimonials or community conversation where people share their stories of being vaccinated as strategies to help boost confidence. And the last thing I will say is, you may have heard that, you know, in November, I think, Chelsea, the Board of Health passed, you know, racism as a public health crisis resolution for Department of Health, and that puts concrete definitive steps for us to right the wrongs of the past. And this is what we're going to do going forward to ensure that our communities get the support and the resources that they need. And that is one way that we're holding ourselves accountable.
Thank you.
Thank you. Ms. Cumberbatch?
Good evening. Thank you for the presentation. I think that it was said and communicated in a way that people can really hear and understand, especially in terms of identifying the buckets of people and their beliefs in terms of why they do or don't get vaccinated. I just wanted to know, in terms of communication, I know a lot of people have the misconception that the vaccine was created too quickly. I know that this research has been going on way before, you know, we had this version of coronavirus. So I just wanted to know what communication is made to those that feel that it was just done too quickly.
Right.
To Monique's point, our community health clinic came to our committee last month and told us that that was the most common thing that folks were saying when they hadn't taken the vaccine, was that it's just coming too fast. So really, like, what's the message to them is part of this. Thanks.
Right. So in addressing that, there are 4 reasons that we provide for why it seems like this vaccine was developed quickly. I like to say that it's like saying, oh, there is an overnight sensation or an overnight star. There is no such thing. If you see someone that rises to the top of the charts, it's been years and years of practice. And it's the same for this vaccine. So we have the advantage of the years of research that have been done on mRNA vaccines. It's been 30 years in the making. So it is not completely new. Number 2, this is not our first rodeo with coronavirus. For those who know, this is SARS-CoV-2. We've had other, coronaviruses, Middle East respiratory, SARS, they were coronaviruses, and the lessons learned from there also applicable here. And generally how vaccines work has been 200 years of vaccines. And all of that information as well. All of that combined with the unprecedented mobilization of resources. I like to say this is a story of unprecedented partnership. Never in the history of the world have people come together in a way that they have done. It took billions of dollars in funding. It took researchers and scientists from all over the world coming together and sharing information. China shared information, genetic sequencing, data that helped facilitate this process. And then, like I said, thousands of volunteers who participated in the clinical trial. On a good day, to recruit 40,000 people to participate in phase 3 clinical trial will take years. Here, people were volunteering on social media to be a part of the clinical trial so we can get out of this pandemic. So these are the reasons why this looks like it was expedited. It is expedited because people pitched in. Researchers, funding, government, regular people who volunteered to be part of the process. And then the years of research that's been available that was mobilized to help facilitate this process. And that's what made this quick. This is what human beings can do when we come together.
Mr. Newmark?
Thank you.
yes.
And thank you very much, Dr. Ige and Ms. Cipriano again for a really excellent presentation. And I'm just really grateful and impressed that people like you guys are able to be as professional as you are in the midst of such a trying circumstance. And we all owe you a debt of gratitude for that. I want to say something that may sound really nuts, which is that, you know, one of the things that's been proven during all of this is that when people are mandated that they have to do it, most of them do it. And I understand I'm a licensed clinical social worker, so I really understand process very much. But I also understand that people do things when they have to, when they're told they have to do it. People get their kids vaccinated to go to school, even if they don't want to get vaccinated. People, if they wanted to keep their jobs in government offices, got vaccinated. The cops and firemen ended up getting vaccinated after all the lawsuits and all that malarkey. So I just want to suggest for further consideration, and you guys may have talked about this and may be talking about it all the time. You're very smart. You probably already thought about it. I'd love you guys to think about other ways with the new mayor and administration to have more mandates in New York City for people to be able to only do certain things that are available to the public if they're vaccinated, because they are a health risk to all of us. This is not fun and games. It's not a joke. This is life or death. And sometimes, and believe me, I'm as liberal, probably more so than many people. And I believe in individual, rights and choice and stuff like that. But when it comes to the community, I believe in the community more than I believe in the individual. And I think that the city of New York, which has done an amazingly great job during all of this, can do even more by being tougher and by not allowing people to do certain things that they're doing now without being fully vaccinated. And that's, I offer that with tremendous amount of course, understanding about how complicated and difficult that might be and how legally that could become problematic. But I just didn't want to have this conversation end without throwing out that component as part of what I think an overall plan needs to include. And again, thank you guys very much. You were great.
Thank you so much. Yep, sorry, go ahead, Dr. Ige.
Yes, Chelsea, you go ahead and please give a rundown of the mandates that are currently,
Sure. No, thank you so much, Barry, for that sentiment. I think, as Dr. Ige was saying, there does come a point where stronger medicine is needed. I don't know the right analogy, because really in the spirit of community health, which is really what public health is. It's not focused on the individual. It is on the community approach, and so taking that very seriously. I know that many may be aware. I just thought it might be helpful to run through very quickly the current mandates in place, and then Barry, absolutely, point well taken, and we're happy to bring that back and express that the sentiment was expressed here, that mandates are good, and your support for additional ones. I think the main mandate that folks are probably most aware of is the Key to NYC, which is for dining, indoor fitness, and indoor entertainment. That was recently expanded just last week to include, or the week before last, to include children. So anyone who is 5 years or older must be vaccinated. And then just last week, it was expanded to include or to require 2 doses. So previously it was if you want to go to a restaurant or a show or to a gym, you needed 1 dose of vaccine. And now you need to be fully vaccinated. You can have 1 dose of J&J or 2 doses of an mRNA vaccine, or a vaccine, approved by the WHO from another country. So those changes were just recent. We, of course, as you were saying, have the city workforce mandate. There's now an extracurricular activities mandate for kids who are participating in high-risk activities at DOE and charter schools. Of course, the state healthcare worker mandate, childcare. We now have a childcare worker mandate, and that mandate was put in place by the Board of Health and also requires a mask mandate for childcare workers. The most recent mandate that went into place was the private sector employee mandate, and more information about that can be found at nyc.gov/vax to work. I'll put that in the chat. I'm like spamming you guys with links, and I'm sorry about that, but I hope they're helpful. And then, of course, the governor's new mask or vaccinate mandate, which basically says your private setting, including common areas of buildings, of residential buildings, need to either require a mask or have a vaccination policy in place in those settings. So I think I covered them all. I was doing that off the top of my head, so sorry if I missed any, but just to give folks an idea of what's in place currently, it is really robust. But Barry, thank you for your sentiments and for your thanks. It has been a true partnership, and the thanks goes to all of you as well for the last 2 years.
Thanks. We're just because we're trying to get everybody's questions in and want to try to keep everything somewhat concise as we're about to approach the hour mark. Ms. McKnight.
Okay, I'll try to be quick. Thanks to the both of you. A great presentation. You mentioned something about hotel stays, and when I check on the website, it's not easy to find. So I was just wondering how can people find out about accessing hotel stays? How can they find out about getting free home tests? Because as we mentioned, equity, that will help a lot of people who live in multi-generational homes. And I think that, and my other thing, what can we do as a community board that would be very helpful? We continue to provide these type of updates during our monthly meetings, but if there's any advice or suggestions that you can give us, we would like to hear it. Thank you.
Yeah, thank you. I will start and then I'll pass it to Dr. Ige. I think first and foremost, you've been so helpful so far. The community boards have been amazing messengers. We know as government, as members of government staff, we're not always the trusted messengers, and nor should we be in many communities, right? That community members and leaders are the best messengers for their own specific communities. So I'll let Dr. Ige talk a little bit more, and I will keep it brief, Brandon, I promise. I think your really important question is, where can you access the services for people who need to safely isolate? So if you have symptoms or if you test positive for COVID-19, and for those who need to quarantine, meaning they may not be vaccinated and they had a close contact and they need to, separate from their family to stay safe because someone is positive. All of that information, if they just call 212 COVID-19, it's basically like a phone tree. You can do a lot in that center. You can ask someone, a nurse or a public health expert, questions about vaccines. You can talk to someone about getting access to these services. You can get access to a healthcare provider through H&H. You can get, another important question, you can get a quarantine or an isolation order from the city. If your employer is requiring you to have that, some employers do require that for New York State paid sick leave. You can get that through that number. It's all there. I'm also going to drop the link for the Test and Trace Corps' website because it's all there as well. This is through our colleagues at the Test and Trace Corps. It's 3 parts: test, trace, and take care. And these hotel services are part of that. So I'll drop those links in the chat. But in terms of help, I mean, a great help. And I think continuing to amplify these messages as people who folks trust is just so important right now, because I know folks are tired. Anything to add, Dr. Ige?
Yes, I just wanted to clarify that the entry process for the hoteling, this is how it happened. So if you go get tested and you are positive, you will be contacted by a contact tracer. Now that person will do an assessment to find out if you will be able to safely quarantine at home. And if you're not, you will be linked to the hoteling. It is very difficult to just call and say, I need a hotel, and to get into the process that way. So I just wanted to clarify that that's how it happens. And two, I also wanted to say that the surge is huge at the moment. So we are having quite a bit of challenge to find, housing for everyone who needs to quarantine at the moment, as you can imagine. So those are two things I wanted to let you know. So, it's a little more complicated at the moment.
That makes
And
sense.
in terms of what the board can do, I think what is most important right now, it is just how do we create spaces for positive stories. There is so much out there that's negative. People hear, someone said to me the other day, I know 15 people that died from taking the vaccine. I was like, seriously, dude? How? And these people say things with confidence. People are really, really afraid. I will tell you a short story. I went to an event. There's a young man who said he scheduled his vaccination appointment 3 times. And each time he chickened out because he was absolutely terrified something terrible was going to happen. That's how terrified people are of this vaccine. And he only did it eventually because it was mandated in his workplace. He just got out of prison. He has 2 wives. He has a wife and 2 children. And so he had to do it. And he said that night he got the vaccine, he couldn't sleep. He was breaking out in a cold sweat, just panicking that I am not going to wake up tomorrow. This vaccine is going to kill me. And then the first day went by, the second day went by, the third day went by, and nothing happened. And he was like, it's been 3 months of me dreading this vaccine. And his story, in that room that day, there were 5 other people who said, I feel the same way. And like now I'm vaccinated, I've taken my 2nd shot, I've even taken my booster, and I'm okay. That kind of story resonates so much with people, more than, oh, I am a doctor from Department of Health, so you should go get vaccinated. Like, duh, who cares? So how do we create spaces for peer-to-peer dialogue, for this kind of conversations to happen in a way that's not threatening, that people don't feel like they're going to be destigmatized or discriminated against for waiting this long to get vaccinated. Those are the places where we need help. We need your help with that, because we cannot, when we set up events and say, I'm the Department of Health, people don't want to come to us. But, these are community boards. These are people that have been representing us and serving us. If those spaces are created by people that are trusted and we can support in whatever way we can, we find that has been more successful than, Department of Health knocking on people's door and say, come get vaccinated. Folks don't always respond well to that.
Thank you so much.
That's great. That's a good question. And thank you, Nicole, but thank you, Dr. Ige, for that explanation. And perhaps there's something we can work together on in that regard in the future. Ms. Einhorn?
Thank you. I just wanted to go back to the specificity of our district. With the zip code 11205, I think what the concern was that we were seeing is not just the underrepresentation, but the fact that there's been stagnation in the vaccination rates over the last 3 months, and where we've seen movement in other parts of the district, there just doesn't seem to be any movement there. And so I'm wondering about how responsive Department of Health and the VCC can be in situations like this, and if you know of any additional resources that are provided once you see that type of stagnation.
Right. Some of the other things that we're doing is the deeper dive in the neighborhoods, and that includes looking at the public housing, the NYCHA developments, and drilling down to which developments are we seeing even lower vaccination rates. For example, in your the neighborhood served by community board, there are a number of NYCHA developments, and we know the ones that have lower vaccination rates, and we have community-based organizations that are contracted to work with those NYCHA housing. And it's just, encouraging them to do more focused outreach there and to support those locations. Other things that we are doing right now is the faith-based engagements. We are offering incentives to houses of worship to host vaccination events, so that those can be opportunities for people to come share their stories, and people can at least hear from, neighbors and friends, what their experiences are. So those are two new ways that we are trying to look and drill down in certain neighborhoods where we haven't seen a lot of movement over time.
And I'll also say we are able to look at, populations and other types of breakdowns of what we know demographic, and trying to work with partners like Dept. This is a while ago, but when we were really trying to push the senior vaccinations up, or we were working with children's vaccinations and working with partner agencies and really the CBO trusted partners who already work with those populations every day. So it's less about like, where can DOHMH insert itself, and more, how can we work with existing infrastructure, with groups and with people who already know folks, and we don't have to go in and say, hello, hi, trust us. It's through people that they already trust and know and work with every day. And so we've been able to do that. I think the CBO, they have the CBO and organization incentive program for vaccination. We've done, I don't even know how many millions of phone calls at this point. And then also just real, like, actual people on the ground canvassing and other lighter touch engagement. Although I know Dr. Ige will kick me under the table for saying this, the real meaningful engagement takes more than one touch. It is not a, we knocked on their door and said, please get vaccinated, and they did. It is a true multi-touch approach that takes more time.
Right. What the CBOs have reported to us is that it takes at least 5 interactions to get someone to even consider vaccination. And I will share with you some of our numbers real quick. So for 11201, 11205, 11217, 11238, this is our totals of engagement over the last 3 months. So the number of people provided vaccine information, over 8,000, people linked or referred to vaccines, over 4,000, the number of mass distributed, 52,000, and in-person outreach events that have happened in your neighborhoods, 324 events. And I will say 11238 and 11205 have had the most engagement of all the zip codes. So we know that it takes time. And we will continue to have this conversation. Again, we see that people are more open as they see cases rise and they see people around them get sick. People begin to reflect again, like, is holding out really a good idea? The biggest challenge we have right now is with children, because even when people are mandated themselves and like, okay, I'll do it because you said to do it, people are more reluctant to vaccinate their children because they're really worried about safety. Oh, what if something happens in 10 years that you don't know about? What if something happened in 20 years that you don't know about? So helping to reassure people that these vaccines don't linger in your body. The vaccines, they carry a message, your body interprets the message, and once you develop those antibodies, the messenger is eliminated. The vaccine doesn't lurk around, just hanging there, waiting to show up in 10 years' time. And this is how the biology of the vaccine is. And it's been 200 years of working with vaccine. This is how vaccines work. They just don't park, build a house in a corner in your body and just wait to show up in 10 years. It doesn't work that way. So just helping people to feel confident to explain all of this in simple terms and help reassure. And also provider engagement. We know people will prefer their own pediatricians or their own providers to explain these things to them. So making sure that the providers also have talking points. We have a relationship with the Brooklyn Hospital. Those were some of the questions you had asked. We have a provider engagement team that just do door-to-door visitation with the hospital one after the other to ensure that they're up to date with the information and to provide them resources and how they can help their patients get connected to resources and services. So those are some of the other strategies that we're using to help build confidence.
Thank you very much. Now I'm going to move to board members and members of the public who are here for their questions and comments. Mr. John Dew, I know your hand has been up for quite some time. Feel free to ask your question or make your point. And if we can just give the question and answer to be somewhat concise, I'd like to try to keep moving things along. Thanks.
It's my electronic hand, so it's fine. Brandon, this is a wonderful presentation at the right time, but I'm going to get right into my point. In Fort Greene, we have 4 public housing projects, Ingersoll, Whitman, Farragut, and Atlantic Village. They all have, what I'm told, extremely low vaccination rates as compared with the rest of the community. We also have a food pantry that Myrtle Avenue runs that services those 4 developments. Maybe we can coordinate with the health department to have a truck associated with and next to the food pantry. And on that truck, if we could have messages from some local heroes and maybe the pastor for the community to help encourage folks in that community to get the vaccine. You should have handouts. Maybe we can give something extra to the folks who are coming to the food pantry if they also agree to take the vaccine, if they haven't done that already. We have to be really creative about how we approach the public housing projects. The other item, Brandon, I'm going to get it all out. There is a concern about the quality of the blue masks that we see most people wearing on public transportation, that the quality of those masks does not represent the highest degree of safety that this virus needs to contest in order to not penetrate. So if they could say a few words about that. And then my last item, Brandon, is that there is a new derivation of this virus that was recently discovered in another country that has infected 14 people as of this weekend. And I just wanted to put that out there in terms of whether there's any concern about it migrating to the United States. Thank you.
Thank you so much, John. I think you're spot on in terms of being creative. So please, whatever you need from us, whatever way we can support, we will be eager to. And 2, you're right, the disposable mask. Right now, we're encouraging people to double their mask. If all you have is the disposable one, then layer on top of that the cloth mask, the disposable first, and then the cloth mask on top of that. We don't encourage 2 disposable masks. We say 1 disposable, 1 cloth mask. And we are also started distributing the KN95 mask. That's a higher grade mask through our CBOs in December. So for those who are older and those who are high risk, the CBOs are also providing the KN95 masks as well. So if there are recommendations for public housing where the KN95s will be required, please let us know and we can ensure that they get there. So you're right about that. And then finally, in terms of the development of new variants, again, as long as transmission continues, we will continue to have variants. As you may know, in many developing countries right now, vaccination coverage is less than 5%. In those countries and in other areas where vaccination coverage is low and transmission is high, the virus changes its shape as it passes from person to person. And so we continue to have these variants develop. Not all variants are a concern, but some become a concern like Omicron. And now the new variants that have been discovered in France may also be one to keep an eye on. The world is so interconnected, it is a matter of time. It is going to get here, you know. So the thing is, how do we ensure everyone is protected? Even with Omicron, we have seen that those who are vaccinated, as you saw from the chart when I started, yes, a few breakthrough cases will happen, but the best protection right now we have is being fully vaccinated, get a booster if you can, and use all the tools in our toolbox as a protection against whatever variants may be coming. So those are some of the messaging that we need to get out there and helping people understand that this is the best way to stay safe in this pandemic.
Thank you.
Thank you. Thank you, Mr. Du. Thank you, Dr. Ige. Ms. Flatbush?
Yeah, hi, thank you. It was an excellent presentation. Much appreciated, very thoughtful. Again, thank you both. I have a very specific question that you might not have the answer for, but you might be able to send this question to the appropriate source. As some of our community board members know, our community will be receiving several homeless shelters for undomiciled single men in the very near future. And we were told that they would be sent, they would be connected to different resources and sent to, if they need healthcare, if they need mental health counseling, addiction, all the services that the city can provide. Since this is a challenging population, I'm wondering if the city could provide vaccinations for the people. Of course, we're not mandating them. I mean, people would have to agree, but on site, so they wouldn't have to deal with getting appointments, finding places, and that process.
Right. That is correct. That program is actually happening. The Department of Homeland Services, DHS, has a program that's like that, providing vaccination on site. And we also have community-based organizations contracted to just work with shelters and congregate settings like that to provide opportunities for conversation and to encourage people to get vaccinated. As you can imagine, these are populations that will require a lot of engagement for them to get, to the stage of making that decision. They're not folks that you can really mandate to get vaccinated. So providing those spaces for conversation is happening. So we have, specific grants just for community-based organizations that work with DHS shelters.
It's very good, much appreciated. I hope that this happens as the men are moving in and not X number of months down the line, because it's a transient population.
Right.
Some people will stay, some people will go.
Right.
Thank you so much.
Thank you, Ms. Flatbush, and thank you, Dr. Ige. Now, this appears to be the final question, so if anyone else has one more burning question, now would be the time to put up your hand. Mr. Flanoy? Mr. Flanoy, you're on mute.
Mr. Flanoy, your microphone is unmuted, but we can't hear you. Maybe we could go to Mr. Varela's question and come back.
Okay, fair enough.
Oh, we could hear you there, Bill.
You can hear me there. of
Yeah,
course.
shout out your question while we got the chance.
Okay, now, thank you. As far as schools are concerned, with children going to school in class learning, and they're not all vaccinated, what's are you tracing the children who are becoming infected at school and going home and infecting their family?
Yes, that's a huge thing right now. In many instances, we have citywide, we have 82% of adults vaccinated, and in children 5 to 12, we are way down in terms of numbers. So we are seeing that children are getting infected at higher rates than adults. Many of the teachers are required to be vaccinated, but we continue to have cases among children and the possibility of them infecting the adults in their lives. So it is one of the reasons we continue to encourage for parents. The best thing you can do right now is to get your kids vaccinated. We are seeing increasing hospitalization in children. We're seeing long COVID in children. So yes, it is true that children tend to have milder cases, but as a parent myself, I don't want to expose my child to COVID if we can prevent it. So the messaging in schools And now resources are being deployed to school. Vaccination is available. Testing is happening in schools. When a kid tests positive, the entire classroom gets at-home test kits so that we can limit the opportunity for transmission, secondary transmission at home and to their families. But the key messaging here is how can we get more children vaccinated and limit cases in children.
Yeah, because I'm feeling that when children go to school and they're infected, they can then infect numerous children at school. It's like head lice. If one child has head lice, suddenly all the kids have head lice.
It is similar, but we are working very hard to ensure that schools are safe. There is transmission still happening in school. I'm not going to say that that's not happening, but every hand is on deck to limit opportunities for school-based transmission. And Chelsea, do you want to say more? But we are ensuring that every tool that's available, testing, screening, vaccination, all the surveillance, all the adults in their lives around the schools are vaccinated to just limit any opportunity for transmission to occur.
Thank you.
Yeah, and I will add, just very quickly add, I think, Dr. Ige, you've been talking about this all night, but the layered approach to prevention, not just focusing on just vaccine or just testing. It is this layered approach, not just for schools, but for every setting, but in particular for schools, in order to ensure that they can stay open as safely as possible. Really is masks. It is, ensuring proper ventilation. It is ensuring vaccination and testing, and and staying home if sick. I often say, as New Yorkers, we're really bad at that one. We've gotten a little bit better over the last 2 years, but we are not good at saying, I don't feel well, I need to stay home. So like Dr. Ige is saying, the testing and the vaccination that's happening in schools right now is just part of a layered approach to mitigation and prevention. And it's not just about those two pieces, although they're, like she's saying, it's all hands on deck for schools right now. But I just wanted to add that pitch, particularly for staying home if you're not feeling well.
Thanks. And I'll get a couple final points here from Alejandro and Carol Ann. If we can try to keep maybe the final points to like a minute and the response to like maybe 30 seconds or so, that would be great. Alejandro, you want to go ahead?
Thank you, Brandon. I'll be quick. I want to quickly recognize the intersection of people who are less likely to be able to stay home because of work reasons and also happen to be the people unlikely to get vaccinated for a number of other institutional reasons. I also want to say real anecdotally that we got an email from our principal that someone in my son's class tested positive, and so he came home with his rapid test, and we're vaccinated and boosted here at home, and so we're not super concerned, but I think the school has been doing the best that it can to keep us all informed, and we've been getting the emails. I think Omicron has made it more difficult because of the backlog in the situation room. And then I just want to clarify quickly, my understanding is that if I'm previously vaccinated or I've been sick, I have a certain level of immunity in my body.
Right.
That level of immunity means that I will have symptoms before I am contagious because my body recognizes the virus, and therefore I will have a few days or a couple of days where I'm not feeling well, and that's a sign that my immune system is working because it recognizes the virus based on the blueprint of the vaccine, which is the reverse of how it is if you don't have any immunity in you, which is to say, if you have not been vaccinated and or you've never been sick with the virus, then the contagion period is often precedes the symptoms because it's sort of silently replicating inside of your body or the virus, and then suddenly you're sick, but you have been contagious for days and spreading the virus, which is why the contact tracing and all of that was very important early on. Is that sort of, I know there are exceptions to everything, but are you seeing that?
The data is not conclusive yet, so I will hesitate to say that is the pattern. The pattern we have seen with Omicron, based on the most recent data from the CDC, is that infection, the infectivity period start from when you start showing symptoms. And it's almost 100% of people, the day they start showing symptoms, are infectious on that day. And then the percentage goes down over time. And by day 5, only about 25%, by day 6, only about 25% of people are infectious. So it is related to the symptom. We haven't really seen the symptomatology vary significantly between vaccinated or unvaccinated for Omicron. But what is important to know is if you have any symptom at all suggestive of COVID, it can be a scratchy throat. It can be, I'm just feeling tired. It can be, I'm having a headache. It can be, I'm having the snuffles, just a runny nose. You may not have a fever. That anything at all that may be suggestive of a respiratory infection, please quarantine and get tested as quickly as you can, because infectivity starts from when symptoms emerge, whether you're vaccinated or not.
Thanks.
The only difference is vaccinated people tend to be infectious for a shorter period.
Thank you. Ms. Church, final point here.
Can you hear me?
Yes.
Great. I want to go back to something that was mentioned much earlier, and that is about the community organizations that are charged with reducing vaccine hesitancy within their communities. Did they have to submit an RFP? Did they give a plan for how they're doing this? And I ask that with some concern because I just looked at the websites and I don't see anything on their websites regarding that program. It would be good for us as the community board to be able to try to promote that, to get information out there. But I just wonder, for me, it seems that they are a little bit quiet in our community. I'm not hearing about them. No one has mentioned them to me, and I don't see anything on their website. So I just want to know, what is the process for evaluating the services that they're providing?
Right. So I am surprised that that information is not available. So we have different sources of funding that support the CBOs, and they apply through an RFP, and I'm going to put the links in the chat for you. So we have some CBOs that are funded through the Test and Trace initiative of the city, and they're the T2 CBOs. And we also have CBOs that are funded through the CDC grants that we have for vaccine equity. And there are 33 CBOs citywide that are funded through that. And we just recently got more funding from CDC for COVID disparities. And through that, we're also bringing on an additional 20 CBOs. Some of these CBOs have a special focus on supportive housing residents, NYCHA residents, those who are unstably housed, etc. And the requirement for the CBOs is they have to do 3 days of in-person outreach per week. They have to do virtual vaccine engagements, and then community conversations, which are small group meetings where information is provided. So if you're not seeing the CBOs active in your community, then I'll have to go and see what is going on. They submit daily report of outreach done, and also weekly reports to us. And we have borough level meetings with the CBOs serving each borough. And then we also have bi-weekly partners forum where CBOs present on the work that is doing and some of the challenges that they have and how we can better support them. So that's the process. But if you need more information about the CBO, I can get those to you, but I'll put the link in the chat for the list of all the CBOs.
Thank you. I'll probably follow up because I think we probably need to help them have some more visibility as well.
Okay.
Yeah, thank you.
Right. Thank you very much for your presentation to us. We greatly appreciate your time being able to spend and speak with our committee. We'll look forward to working with you more in the future, and let's hope that we can all be successful, and we're certainly rooting for you to help us be successful, particularly with addressing the disparities in neighborhoods like 11205. Thank you very much. Have a great evening.
Thank you.
For sake of time, we're going to move on to the next part of the agenda, which is the new full on-premise liquor licenses for the evening. We have 142 Smith Street, Wanisa Home Kitchen. Do we have someone here from that location tonight?
Yes. Hi. Hi, how are you? How everyone? This is James. Nice to meet you guys.
Hi, James. Do you know who's going to be presenting the liquor license onto the screen here? Is it going to be you?
Happy
or is it
to.
gonna- Okay, you got it, Jessica. Great.
Yep.
Thanks. All right, Mr. Lamb, do you want to give us a quick once over of maybe a minute or two about your application?
Yes. Hi, everyone. Our business actually is located on 142 Smith Street, and our restaurant name is called Wanisa Home Kitchen. We opened since 2017 until now, and we are serving like a Thai cuisine. We are a Thai restaurant, and we have been opening since 2017, and the business hour is from 11:30 to 10, 7 days a week. We are currently have the BNY license, and we would like to upgrade that to the full liquor license because of we are trying to see if we could increasing our revenue or the food sales if we add in some cocktail, and also we will be able to bring up the business. Since we had very difficult times in 2020 of the pandemic, and we are trying to see if we could adding some new cocktail drink and increasing our food sales. Basically, we are doing like the dine-in restaurants. We are not doing like any loud music. We will be keeping like the restaurant as a very cozy restaurant inside, and with the recorded music background. And we will also providing the food dine-in and delivery services. So this is what we are planning to do, for this coming year.
Thank you very much, Mr. Lamb. Are you serving beer and wine right now, but you're not serving liquor?
No, we are not, because our license right now is only allow us to serve the BNY at this moment. So we are planning to change the class to be able to sell the cocktail, with a full liquor license.
Okay. I thought I saw a couple of items on your website of like mojito, Mai Tai. Are you sure you're not serving liquor? Or?
Those are we are really using the what we call the wine, the sake wine to make the drink. It's not using any high alcohol like a rum or anything like that to mix the drink. No.
Okay. Questions from the committee?
Yes, Mr. Chair.
Mr. Harrison. Mr. Harrison, floor is yours.
Thank you, Mr. Chair. So I have a question that I'd like to direct to Ms. Church, if I could.
Is it regarding this application?
It is.
Okay, if you can
Carol
just make the question brief.
Yes.
Thanks.
Carol Ann, do we have any knowledge of any complaints?
Ms. Church? Okay, Ms. Church says none.
Okay.
Oh, go ahead.
Brandon, so based upon that and the fact that it is already half past the hour, I would strongly, I understand that we have a process, but I would strongly recommend that we approve this.
Okay.
And if you would allow me at this time to make a motion, I am making the motion. If it is out of
Can you just
order-
hold on until I solicit
Absolutely.
From the public?
Yes.
Thank you.
Yep.
Is there anyone from the public or any other board members who have a question about this application? I see no questions. Mr. Harrison, sorry I didn't get to introduce you previously, but feel free to make your motion. And I also want to welcome Ms. Cobb to the meeting too, who's one of our members.
Okay, Brandon, thank you. So John Harrison, member, I move to approve this application based upon the fact of no complaints and the content which the individual has already presented.
I second that motion, Alejandro.
Okay, moved by John, second by Alejandro. Discussion on the motion? No discussion. Mr. Varela, how do you vote?
In favor.
Mr. Harrison?
Yes.
Ms. Cumberbatch?
Yes.
Ms. McKnight?
Yes.
Ms. Thurston?
Yes.
Mr. Newmark?
Yes.
Ms. Cobb?
Yes.
Ms. Einhorn?
Yes.
And I vote yes also. Unanimously approved. Thank you very much, Mr.
Thank you.
Lamb.
Thank you so much.
Good
Thank
luck
you.
with the rest of your process, and
Thank you so much.
hope
Thank you for
everybody
everyone.
stays healthy and well with you.
Thank you.
All right.
Yeah. Have a good night, guys. Thank you.
Thank you.
Thank you. Mhm.
Now, we have a few liquor licenses on our agenda where we either they didn't show up, or they didn't send paperwork, and we have to go through them just to see maybe somebody showed up or there's something going on at the last minute. 25 Bond Street Cafe Plus. Anybody here from that location? Going once, going twice. Okay, next up, 82 Henry, New Fortune House. Anyone here from 82 Henry, New Fortune House? 118 DeKalb Avenue, Textbook Cafe. We have anybody here from 118 DeKalb Textbook Cafe?
Yes, hi, that's me, Sean.
Hello.
How are you?
Great. We can put up the application here. I think if you could just kind of start off with what the hours are going to be, because that wasn't specified on the application, and we will need to know that information.
Yeah, that's an old one, but our hours are from, right now, it's basically gonna be the same hours as the pizzeria next door, but it's gonna be a coffee shop, so we're gonna open up at 7 a.m. and we'll probably be closing around 9 p.m.
Is there any outdoor seating?
Yeah, there's gonna be outdoor seating, yeah.
Okay. We will need you to put all of this information on the application. So what will the hours for the outdoor location be the same as the indoors, or will they be different?
It should be the same, yeah. I have an updated one here. I don't know why you guys have that one, but it has all the hours and the diagrams of what the place will look like. So I could resend that to you guys if you need, but the attorney should have said he sent it to you, and so I apologize for you guys not having the updated one.
Okay. What will be the music inside? Background only, or
Yeah.
DJ or anything like that?
Yeah, just background music, no live music, no DJ.
Okay. And you said 7 a.m. to 9 p.m. are the hours?
Yes.
What is the outdoor area like?
It's the corner spot, so we'll have shrubbery around the outside seating area.
Is it in the front or the back?
It's in the front.
Okay, so it's like a sidewalk cafe?
Yes, exactly.
Okay, is this like a open streets kind of thing, or it's literally on the sidewalk?
It would be a sidewalk cafe, yeah. So we'd get the extra permit to get the sidewalk. There you go. That's it.
Okay, when do you plan to open?
We're hoping sometime in April. The architectural drawings have just been approved by the DOB, so finally we could start getting a contractor in just to do the cosmetic work.
Okay. How many people do you intend to hire?
There'll probably be about 3 to 5 people on staff.
Okay. We do encourage folks, while there's no bearing on your application, to hire locally and try to target Fort Greene Snap, Ingersoll Community Center, Brooklyn Navy Yard as potential sources. Do you
Yeah,
intend
that
to
would be
hire
great.
locally?
Yeah, I live in Bed-Stuy, so that would be amazing. We're only looking for local hirings.
Great. Any questions from members of the committee?
Mr. Smith, I would just direct you to the comment in chat, please.
Okay. So
I have a, oh, I see John's hand is up.
Okay, it's all right. I can wait.
Mr. Littman, is from the application, it says that you don't have prior experience. When you started, you said that you'd be open the same hours as the pizza place. Are you in some way connected to the pizza place? And is this in fact your first restaurant cafe business?
Yeah, this is our first my first restaurant cafe. I owned a sports company before, and the hours I said we would relate to the pizza places because he's the landlord of the building right next door. So we were just gonna go by what his hours are as a pizzeria.
Thank
Okay.
you.
We will need to have the completed application sent to the office. So please make sure that that's the case. That would be a condition of any vote that we will take.
Yeah, I sent that first one. I see 1229, and then we fixed it.
Whenever it got sent, as long as we can get one that goes to the office, it doesn't seem like they have one currently. So I don't want to.
Mr. Littman,
Sure.
if you have a copy of the completed application with the hours, you could put that on the screen because this meeting is being recorded.
Sure.
You could go ahead and share screen with just that page, please.
Oh, I don't have it saved on my. I have it just as a hard copy.
Let's see if you can get that close to the camera so we can read it.
Let's see. How's that?
I'll leave that to Ms. Church to make the call.
Mr. Littman, there you go. If you can.
Does it say 2 p.m.?
That's for the alcohol, yeah, for the beer and wine.
Okay.
But the coffee shop opens at 7.
Okay. Alcohol 2 to 9 every day?
Yes.
Okay.
Yeah.
Thank you.
All right.
My pleasure. Sorry about that.
All right. Any other questions from members of the committee?
Yeah, Brandon.
Mr. Harrison?
So if it was said, I didn't hear it, what's the cross street?
It's St. Felix. So it's DeKalb and St. Felix, that corner.
Okay, I got
So
it.
it's across the street from Brooklyn Hospital.
Right.
And that Love and Oven Pizza that you see there, that's the landlord of the building.
Right, so sir, this is in a space that was formerly a deli.
Yes, it was a deli.
You know
correct.
exactly what it is. Okay.
Any questions from members of the public or board members for this application?
Are there residents who live directly above or beside you?
Yes, there are apartments above, which is owned by my landlord, Love and Oven Pizza. And yeah, there's up the block, up St. Felix is all, I believe, brownstones townhouses.
And have you heard anything from your neighbors? Has anyone chimed in concerns or questions or enthusiasm either way?
Yeah, when I was going to get the signatures up and down the block, everyone was super excited about a coffee shop. I reached out to the actual person right next door, the neighbor. I think that's her on the screen there with her hand up a while ago when we first started looking at the location. So yeah, everyone seems very excited for a coffee shop because there isn't really a coffee shop very close by. It's about 3 or 4 blocks each way, which in Brooklyn could be a very far distance.
And just to be clear, you said at 9 p.m. you will close, or 9 p.m. you will stop serving liquor, or same?
Right now, our goal, we will probably close at 9. It may change depending on how business is going, but those are our hours as of now, yeah.
Just know that the hours that you put on the applications are for serving liquor are the ones that get submitted to the state liquor authority.
Okay.
And then, yeah.
It looks like we do have a member of the public who has a question. Miss Benita Hussein,
Hi.
thank you very much for joining us. Feel free to
Thanks.
raise your question.
Thanks. Can you hear me okay?
Yes.
Oh, great. Hi, Sean.
Hey,
So
how are you?
I'm good. So I
Just
am.
just for purpose of meeting decorum, we do follow Robert's rules here, so everyone should be addressing the chair. Particularly, we notice in comments between members of the community and applicants. I encourage that. So sorry if I didn't clearly mention that before.
That is fine. So so I am a neighbor at number 3 St. Felix. I think that I would also, I do think that the block, which we have a very active block association on St. Felix, where we do, try to keep up with each other on any issues that we are facing around things like vermin or trash pickup and anything. And I would say that we are looking forward to having a coffee shop on the corner. I think the question would be around that sort of section that would be on St. Felix. I did notice there were tables and shrubbery. It is a very quiet block. It is a very small residential block. It is a one-way street. So we tend to have a very, it's very quiet normally. So I think there would be concern just about activities happening late at night, specifically if there's loud music or just any sort of ruckus happening when people are drinking outside, especially along that corridor on the St. Felix side. So that would be my one concern I want to raise here. And I've never participated in these board meetings before, so please let me know, what else I should be able to ask or answer on this particular location.
No, I think you've done a great job of raising your question. Mr. Lippman, could you potentially address Ms. Hussein's concern regarding the outdoor location, how it will be maintained, how noise will be controlled on the outdoor area?
Yeah, of course. This isn't like a party place. That's not what I'm looking to start. It's more like of a date night type of atmosphere. So there might not even be music, but if there is, it would be very low type of classical music, possibly not even outside the cafe, maybe only inside the cafe. But it won't be a ruckus type of atmosphere at all at the location. We're just going to be serving glasses of wine or craft beers with high-end sandwiches, baguette sandwiches. So it's definitely not a party place atmosphere, not a lot of music, if any at all. I just had to click, a type of music on the application. So it would be just recorded music if there is any.
Okay, thanks. I do see that you're going for beer and wine and not full liquor.
Correct.
So that's noted.
May I add just another comment to the chair?
Sure.
Yeah, I think that makes sense. I would say that just on this section, again, having public seating on the St. Felix side, I just imagine that there might be some additional activity or noise, or just would love for that to sort of be noted in this discussion, that is will be the first time there was any commercial activity on the St. Felix corner on the St. Felix piece. So would also just want to make sure that that is something that is noted here.
Mr. Chair, if I may.
Mr. Varela, sure.
I guess to Ms. Hussein and Mr. Lippman, I think it's important in the past when we've had these sorts of concerns about how will it go, and it is a kind of for the community, it's a bit of a gamble because you have no idea, right, how it's actually going to be. It sounds like you are already in touch. I would really encourage you to exchange information so that if there are issues, I hope Mr. Lippman will respond to them. It sounds like you will, but I want to put words in your mouth.
No, I mean 100%. When we first looked at the location, I went ahead and reached out to the Miss Hussein who lives there to let her know that I'm looking to open up a coffee shop, serve some beer and wine during the day at night. Wanted to make sure she understood what we were doing. So yeah, I'm very forthcoming, very transparent. If she has any concerns or questions, or anyone on the block, of course, we want to pair up with, I have 2 children in public schools in the city as well. So I want to pair up with the Brooklyn Tech High School to see if we could volunteer and donate any of our goods there, as well as to the hospital. We really want to put ourselves into the community and help as much as we can.
Okay. Mr. Lippman, how many tables will be on that side of the street?
Probably only about 3. I think that's all we could get on that side. And then maybe 4 or 5 on the DeKalb side.
Okay. And will you be on site there at all times, or will there who will be on site there at all times?
We'll definitely have a manager on site. I will be there a lot, but not 7 days a week, 10 hours a day. But I will be there every single day checking in, but we will have a manager on site at all times.
Okay. And we would just ask that you be receptive to the community concerns about what's going on that side of the street. And if there is a significant amount of noise from it, potentially consider, I don't know, putting up signs, speaking to the people there, and maybe even if it's getting very noisy, limiting the one or two tables. But
of course. Yeah, 100%. Like I said, I want full transparency and openness with the entire community. So I'll always be around and be happy to oblige.
Any other questions for Mr. Lippman?
Actually, I have a question for you, Brandon.
Okay, this will be the last question. Mr. Harrison, the floor is yours.
Okay, thanks. So it's concerning this issue. So bring me up to stuff, Brandon. Are we still in a situation where the city is not requiring applicants such as the gentleman before us now to apply for an unenclosed sidewalk cafe, or where are we at with that as a city?
Well, the application is before us to have the area indoors and outdoors from a liquor license perspective. Ms. Church, do you have any guidance on how transportation is handling the DCA side of it?
Can you hear me?
Yes.
Yeah.
Okay. So these aren't going to go to transportation because they're not subject to approval under those same regulations. The only thing that will probably be coming would be approval of the liquor license.
Does this mean that Mr. Lippman does not need to go to transportation for the DCA side of this?
There's no more DCA
Okay.
oversight on this.
All right. Thank you.
All right. I think we clarified that point then. Do we have a motion with regard to this application?
Make a
I
motion
would
to
move to
approve.
approve. Oh, sorry.
All right. It's a combined motion, but I'll give Jessica the motion and John the second. Any discussion on the motion?
All right.
I'll just,
wanna make
oh, sorry, Alejandro, go ahead. Oh, I was just gonna say very quickly, I'm excited to have a coffee shop right across the street from the hospital because when we have our meetings there in normal times, I desperately need coffee beforehand. So it seems like a very innocuous application and we're happy to have you.
I appreciate it. And whenever you do have those meetings back in person, please let me know in advance and I could, of course, service the whole team.
Well,
We have to pay for things, yes.
Whenever we talk.
We're public servants.
Let me give a complete disclaimer here for 1 second. One, we are the HESS committee. We decide, we make recommendations about liquor licenses. We do not do so under any consideration of receiving any service from any person or any kind of item from any person. So please, everyone understand that and note that for the record. Was there any other discussion we want to have on this application?
I just wanted to be sure. I didn't understand if it was enough that he held the application up to the screen. I don't think it should be, is what I guess I'm getting at. I think it should be sent into the office. I've
said previously that it's a condition of any approval that there be an actual copy of this application sent to the office. So that would be a condition of this motion, and really it's incumbent upon anyone who comes before us to give us something in writing. It's great to see it on paper during the meeting. I'm more concerned about the fact that we can discuss and agree to what the hours are. I think we understand what they are now, but what really counts is that we do get something in writing eventually, which is the point that you've raised.
Right.
Any other points for discussion on this application?
No, just Brandon, really quickly, I would agree with Jessica. I know the applicant said that there's not a coffee shop within 2 to 3 blocks, but it seems like further, and I think it would enhance the neighborhood.
Okay. Well, thank you for that, John. With that point, I'm going to take a vote on the motion. Mr. Varela, how do you vote?
In favor.
Mr. Harrison,
Yes.
Ms. Thurston,
In favor.
Ms. Cumberbatch,
Yes.
Ms. McKnight,
Yes.
Mr. Newmark.
Yes.
Lindsay.
Einhorn. Yes, sorry.
Yes. Thank
And
you.
Ms. Cobb. Ms. Cobb,
Yes.
thank you. I vote yes as well, too. Thank you very much. Good luck with your establishment.
Thank
And
you. I'll get the paperwork right over to you after this meeting. And thank you guys so much again. I really appreciate it.
please do that. Thank you.
All right, take care.
All right. Finally, 177 Atlantic, Esprit Sushi. Anybody here from that location? Hearing no. Going to move on to the renewals. We have a number of renewals that consist of 139 Flatbush, Chuck E. Cheese, 320 Atlantic Avenue, French Louie, 73 Atlantic Avenue, Montero Bar and Grill, 415 Myrtle, Cardiff Giant, 240 DeKalb, 2 steps down, 2834 Columbia, aka 32 Joralemon, River Deli, not to be confused with River Cafe, 135 Atlantic Avenue, Chez, 286 Livingston, Burger Village, 97 Atlantic, Bohemian Bar, 300 Schermerhorn, Grand Canyon, Bistro, 372 Fulton, Gage and Tollner, 222 Green Avenue, Tarachi. Ms. Church, do we have any complaints or concerns expressed from the community about any of these renewals?
I've not heard any.
Okay. Any comments or questions on these specific renewals from any members of the committee, the board, or members of the public who are here? Okay, not hearing any. At this time, I'll ask for a motion to be raised.
Move to approve.
Motion from John. We have a second.
Mr. Newmark.
Mr.
Second.
Newmark. Mr. Newmark has seconded, I think. All right, we'll put Mr. Newmark for a second. Can you, I'm going to do this also by consensus, but I think if folks, if anybody can speak now, if you oppose this motion or if you abstain from this motion, I will consider it to be passed. Otherwise, members of the committee, treating that as a unanimous approval. Thank you very much. Great. Moving along in our application, we have the chairperson's report. I'm going to keep this brief, noting the late hour. The one thing I want to bring up, and I'm hoping to bring this up later, which you all may remember with respect to district needs. We may not have a lot of time for this evening, but if I had encouraged everyone to kind of come with 1 or 2 priorities that you thought should be noted for this meeting. The one thing I'm really think that we should do something about, whether it be a district need or a presentation, is we've spoken about compost a little bit before, but I really want to kind of link that conversation to climate change, because there's a real impact with food waste and food production on climate change. And I feel like there's probably something that we can do in terms of a committee or in terms of a district need that addresses that issue. And I certainly believe in bringing the forth items that relate to our energy providers on the one hand, but I really think that food, and whether it be on the waste side or on the production side, is definitely an issue that I'd be interested in putting something together on. Other than that, we do still have plans to bring in National Grid in the future. Reminder, we've got district needs responses hopefully coming for the February meeting. And with that, I'm going to move on to the next item on the agenda so we can keep going for the evening, which is other business. We have, interestingly, district needs. And I think that it would be productive if we can each just kind of try to have a brief discussion about anything that we feel like should be a big priority. And I also wanted to remind everyone that we had agreed last time to try to set timelines. And my proposal was to kind of come up with was to have the final district needs prepared at the June meeting, and to have any sort of policy goals that are loftier than a specific district need defined by the March meeting. That doesn't mean we can't come up with a district need in say April or May. But what it does mean is that we can't come to April or May and just come with something very general, like I want to address, I don't know, homelessness, unless you have like a really specific thing that you want to address about homelessness that we can do in the form of a district need addressing capital and expense items. So I guess right here, I would just kind of want to open the floor to the committee first. And I think Ms. Flatbush might have a point, but I'll get to that in a second. Ms. Thurston?
Yes, the issue I would love us to focus on is one I think I raise every year, and I apologize, but it's green infrastructure. As one of our climate humans here, I'd love to think about ways to, and part of this I'm very happy to take on, is to be, when I say green infrastructure, I recognize it's quite broad. And so I think it's getting specific about needs we have in this district. Maybe it's bioswales on Flatbush, which is something I always want more of, or maybe it's 3 things that are green infrastructure related, but tied very closely to other pronounced issues and topics in the district, like out of control development or overburdened transit systems. Like there are things we can tie to these other issues that we know cause other forms of inequity. So I will be more specific about it, but broadly speaking, I'd love to see us address green infrastructure more specifically.
Great, thanks. That's definitely something that we can include and work on. And hopefully, like with you saying that, and with anybody raising one of these issues, the idea is that like you can be kind of the go-to person for that particular kind of issue. Thank you, Jessica, and appreciate you being concise. Is there anyone else who really wants to get it off their chest what their particular issue is? Ms. Cobb, I see you've unmuted yourself.
Yeah, I have an issue around rodent control, and I don't know whether that would come under, but the
Yes, it
rats
would.
are just running rapid in the community. So rodent control.
Okay, that's great. I think that I really appreciate you raising that, Akaswa. And if we can, we have a few rat-related items that have been on the district needs statement in years past. Perhaps if we can work on something that will be contemporary to this time and very kind of specifics. I don't know if it's like trash cans that are more sealable, or just making trash picked up a little bit faster, or something else that we have in mind for that. I would really look forward to seeing what that ultimately becomes, but I'd love to have your input as to what it shall be.
Okay.
Cool. Anybody else on the committee? Barry, you're in, or no, I'm not going to go to Barry. Alejandro, go ahead.
Sorry, I believe there are people who have.
We can't hear you.
I was noting that there were people who have their hands up before me in committee.
Oh, I see Miss Einhorn. Miss Einhorn, do you want to make your point?
Sure. I think I have 2 things. So one is I think it would be great to see some dedicated mobile COVID testing and vaccination resources, as this is going to be while the pandemic may come to an end within the year, it's going to be an ongoing health crisis longer than that. And so looking at the long-term solutions, I think, is important. And having a mobile unit that can be responsive to where the needs are would be fabulous. I also think I really want to go back to the assessment conversation that we had last time. I'd really love to help support figuring out how to do a public health roundtable that could help support our development of these items. And if there's any other interest in that, I'd be happy to help with it.
Well, I know, and we all know Ms. Masso has been very interested in having a roundtable, and we were going to have that as part of this conversation tonight. Perhaps there's a way that we can work together on that, and so you will be kind of our person to address both that side of the COVID labs and and working on the health fair a little bit, although, you know, we certainly will welcome anyone else who wants to collaborate on that. Mr. Varela, did you want to raise your point now?
Yeah, so I have three, only two. One is that I would still like to push for more maternal and child health support, prenatal, perinatal, and then postnatal. And there's a wealth of research on this to show how important it is to focus on these first 300 days of life for both the child and the mother. So I don't think we'll have trouble finding the data to support it. And I believe there are programs already in the city, some of which are government funded, and some, well, they're probably all government funded, but some of which are direct providers from the city, and then others CBOs. So I don't know if it's too much to ask that we in some way connect all of these things or centralize them, or just support them in general across the board. But I would like to see that. That's one. The other one is along the lines of what Lindsay was saying, is that I have this dream of New York City public schools having a public health component to them, sort of not just clinics, but become health centers in some way. I know that sounds very big. It's smaller than that, but just that I'd like to get to a place where children, 1 million children don't have to make pediatrician appointments to get vaccinated, but they happen at the school, all of them, and or that is where you go to get your information on abortion rights, or whatever it is, that running the gamut of health needs for children and young adults. And so I don't know if that's the pilot is COVID there for this, which could be the great entry point. They exist in some fashion, but anyway, so just that one. And then my last one, but I haven't really figured out how to make it CB2 specific. But at the federal level and at the state level, we have reparations bills on, that are stuck. One of which, HR 40 at the federal level, has been brought back for 30 years straight. And here at the state level, I believe for the last 2 years, there has been a reparations bill, reparations for the descendants of slaves, enslaved people, sorry. And so I want to try to find a way to have that conversation at the city level, and specifically within our district, because there are direct lines between that and the porous census tracts within CB2. And so if we really want people to change health behaviors, or we want folks to, be healthier, we have to make the conditions in which they live better, and we have to give them control over their own lives. And some of that is about restitution and making amends along the lines of what Dr. Ige said at the beginning. If the government has let people down forever, why trust? Anyway, so putting that out there.
That makes sense, and I think it's great that you want to work on the maternal health prenatal issue. I would love to help you in that regard. And the reparations, do you see that fitting into a city related item somewhere? Because remember, that's what we're doing. How would that fit?
I'm going to work on it.
Okay. If you're going to look, I'll
just dropping the kernel. I got to give it some thought.
That's all we need right now is and honestly, it's great. I believe in you, and I hope I will look forward to seeing what comes out of this. Ms. McKnight.
I just want to say I will help you with the maternal and infant mortality issues, Alejandro, because that's something that I think we need to focus on as a subcommittee. And something that we haven't mentioned lately is dealing with mental health, perhaps some type of mobile crisis intervention type of efforts, and if we can target it towards our youth. We know, I just read recently, there's youth that are getting very much involved with gangs. So perhaps if we can have, it's not directly related, but if we have some type of interventions dealing with social issues and mental health issues, I would like us to explore that.
Thank you, Ms. McKnight. And just, you meant we should address this as a committee, right?
Yes,
Not
yeah.
as a subcommittee, because we don't have subcommittees, and that is.
Oh, that's what I meant, committee.
That's right. That's
Yeah,
right.
thank you for
No
catching
worries.
that. Yeah.
Wonderful. Anyone else from the committee? Mr. Newmark, Ms. Cumberbatch? Did I miss anybody?
Well, in terms of, I know we are talking a lot about the homeless shelters that are going to be in the neighborhood. So in terms of social services, I know that they will be offering some social services, but identifying in those neighborhoods that we know there's going to be homeless shelters, what organizations are there that can be connected to that homeless shelter to provide services, so that we're connecting to in-network social services, or even, you know, any activities that folks can do during the day where they're not, you know, lingering outside, trying to see what we can do to engage that population.
That's great. I'm really happy you raised that, because one, we want to have coverage for all of our different areas, and I don't think anybody had raised the issue of social services, and I think it'd be great to have something fit into that aspect of our committee. So maybe we can, if you can take the lead on that, Monique, we would love to have it, and we'll definitely look forward to seeing how we can wrap that in a little bit more.
Okay.
Mr. Harrison or Mr. Newmark, anything that you want to add?
Actually, yes, Brandon, and it's kind of a large one. It's something that the committee has discussed since I got on this board, which is a long time ago. And I think it's a condition that has been exacerbated by some well-intentioned things, not the least of which was the huge push towards not really city bikes, but bike lanes. And that is the amount of particulate matter and CO2 that is so prevalent in the district. One of the impacts is the fact that there have been more than a couple of large through streets like DeKalb and Lafayette that have been reduced in lanes, causing a lot of backup of traffic of all kinds. But it's now true also on Vanderbilt. Another impacting factor is the development. Still yet another impacting factor that we discuss, and Alejandro, I have to hand it to him. He raises this from time to time from the health standpoint, is the horrible amount of poisoning of people who live in the projects because of the BQE. So I like what Jessica has said, and I'm wondering if somehow the green push could somehow be a solution to this. I don't really have a solution. You know, I looked at your email and I thought, well, it's a problem. It's a large problem, but I'm thinking that there are ways to somehow reduce the amount of particulate matter and reduce the amount of CO2 by increasing the ability for traffic to flow through, and by also perhaps getting the city to agree that future development would include some kind of mitigating factors in the form of trees, bushes, and the like, because it is huge in the district. It really is. The amount of poisonous toxins that come off of mostly off of vehicles, but some off of buildings, but mostly off of vehicles, is huge in the district.
Great. Well, thank you, Mr. Harrison. I think definitely the emissions into the air is going to be a big issue, and we'll look forward to seeing what the response was from the city agencies next month as to the item that we had this year that was about the BQE and air quality and such. and hopefully we can each kind of collaborate beyond just these specific areas, but we have some specific areas laid out here where each of us can sort of take the lead on working on them. Before I go to Ms. Church, I see Ms. Flatbush has had her hand up, and I don't always incorporate everyone else into this, but you have had your hand up a while. I'll let you raise your point if you'd like, if it relates specifically to district needs.
Yeah, yeah, I have other things for later, but I was impressed by the committee's issues that you've raised. I think it could be helpful to collaborate between my committee, the Youth Education and Cultural Affairs, and your group in terms of school-based health clinics. There are school-based health clinics throughout the city. They're not in every area, in every school. And I think it would be helpful if we got a speaker and maybe met jointly to find out where they are and what their issues are, so that we could advocate for them if that's what the direction we want to go. I mean, the other direction is like community schools that have some health components, but not as structured as a school-based health clinic. So I wanted to mention that. I also attended your committee when there was a discussion about doulas to help women pre-birth, during birth, and postpartum, and there's family nurse partnership. Apparently there's been more funding for the doula program. I'm not sure if it's the city or just Brooklyn, but I think to have someone speak from the city to let the committee know what that program looks like, what they identify, so that the statement of needs, from the committee would be well informed. And one of the members talked about youth and gangs and mental health, and that's another area of collaboration, because we've mentioned that from time to time in our committee, but we've never really pushed it forward. So great idea.
Great, and I think there are definitely some things that we can work together with you on there, Betty, and I'll love to chat with you about that. Ms. Church, you have your hand up too. I want to give you the floor.
Just wanted to respond to a couple of ideas that were put out there. Just to say that we may need to move a little beyond the basic ask, because some of them are already in place at some levels. For instance, the bioswales, which, like Jessica, I love, although some people don't because they collect trash. They have actually installed probably as many bioswales as they can in our district. It's a recently completed project. So we may want to think about the other level of green infrastructure that we can get. Someone mentioned developments having to put in infrastructure. Well, that's already a local law, I think. So all new development, and there's over a particular size, so I don't think it applies to, say, a 2-family home, but larger developments must do some form of green infrastructure. So I'm saying, so we need to look a little beyond the initial thought and see how we can bolster those ideas for our needs. The other thing that Monique mentioned was the provision of additional social services to folks who are in shelter. And I wanted to add to that, not just social services, but also community-based services. A project I worked on, but sort of the shelters had some sort of staffing issues, so we never really got it off the ground, was creating a red carpet experience for shelter residents at the local cultural organizations. And I think, and we were going to do it really without any funding, but it might be something that we can ask for, but we'll have to talk to the organizations again. It was like Brick, Mark Morris, BAM would have a special time where residents of the shelter can show up and receive a sort of group tour of the facilities and hear about the services. And it would be just for them. Why? Because even though we have these places and we may know that they're open to the public and they have free programming, lots of people, they don't even have to be undomiciled, won't enter those doors because they just don't feel welcome for historical reasons. And I think that's a program that we could probably add to just social service, because yes, you need social services. Yes, we need food and clothing and whatever, but we need the other parts of ourselves. So just wanted to throw that out there to add to the social services component.
Thanks, Carol Ann. Do you think we're still on track to get the responses from the city agencies to last year's needs in February, or is that not realistic?
I couldn't answer that with any sort of certainty, but they do give it out in January, historically.
All right. Well, we'll see how that goes. But I think the main deadline we want to focus on is trying to get get these things finalized from these initial ideas here tonight to definitely something very specific by June. And in the meantime, if you have any new ideas, definitely let us know before March, because that's when we're going to finalize our new ideas, or at least that's the rough plan.
Well, sorry.
Go ahead, Carol Ann.
So I came up with a little bit of a timeline. March is a little early, but yeah, I get what you're saying, because we're going to need to compile things, but we could go a little further out. But I think by the June meeting, we need to have some sort of real sense of what we'd like to present. And I want to talk to you and Nicole and Jessica about possibly scheduling the public hearing for our HESS meeting, the public hearing on the needs statement, only because we carry the bulk of the needs as our portfolio is so large. And so it will also, because we're early in the month, it also gives the other committees time to go back and adjust based on what they've heard in the month of September. So we can have the board vote on the 12th of October, which gives us essentially 2 weeks. It's still, I feel like 2 weeks is a little tight, but it's 2 weeks in which to write up the final document. And if we do it right, by providing context and references for the needs we come up with, it should be way easier to get it done.
Yeah, I agree. I'll look forward to scheduling that with you. I think that will be key. Let's see.
Barry has his hand up. Barry has his
All
hand
right, Barry, we can have a final comment from you here.
Oh, thanks. I didn't want everybody to think that I might have fallen asleep during this conversation, because I usually say things more quickly. But I was really interested in hearing what you guys all put forth, and I think they're great ideas. I have to say my past experience with the need statements and with the response from city government to them leaves me somewhat cynical and pessimistic in terms of progress. But the only way you make progress is by yelling louder and keep trying. So I think everything that guys have put forth makes a lot of sense to work on. What I was most importantly wanting to hear about, but I didn't want to be the one to raise it again, because I felt I got a little pushback when I raised it last time, was a public meeting. Because I think to not have the public invited to offer their ideas about what they feel they need for their lives in the community is really disrespectful. And even if we get one person who offers something, we've at least tried. I would just wish that we could do it earlier and more frequently, so that we give people the opportunity to really let us know what they feel they need, as in connection with our, I'm sure, very accurate observations about needs in the community. So That's all I have to say. Thank you.
Thank you, Barry. And as Carol Ann had raised that point, you know, and we'll definitely make sure that we address your concern. Moving along into the agenda. Our next item is community forum. Do we have folks here from the community who would like to speak?
Do I get to speak in this part or in another part? I'm always confused.
Well, this might be your last opportunity, Betty.
Oh, great.
But wait. Can I just see if there's anyone else who's not a board member or member of the
Absolutely. Go
committee
for it.
who wants to speak? I actually see everyone here is either a board member or a member of the community, of the committee. So the floor is yours. You've got 2 minutes.
Thank you.
And
I love your committee. If I wasn't chairing my committee, I would be on your committee.
that's great. Expressions of admiration are accepted, but it's part of your 2 minutes. So that's
Oh dear. Okay, two
Thank
things. Last year, your committee met with my committee around asthma and open airways and so on. I wanted to give you a brief update, which isn't great, but the person who was the key person in that program retired. And due to the nursing shortage, there are what's called agency nurses or contract nurses, which is like substitutes. So schools are covered. In other words, we're not saying that schools don't have a nurse, but it's a nurse who comes in that day or that week and gives medication and, you know, first aid and does the very basics, but isn't part of the school community, doesn't deliver a curriculum, et cetera, et cetera. So that's something, I mean, it's a citywide issue. It's because of COVID, it's because of salaries, it's, you know, a lot of issues beyond us, but I did want to get back to you and say that that program is not happening, probably in a large part due to the nursing shortage. And the other thing, that I wanted to share. I didn't write notes. Oh dear. Okay, so
before we get to that other thing, let's
Oh, yes.
definitely pick that question up and try to see if there's some way we can move the ball forward on it. I think it's understood that, you know, that there are issues at the moment with that may prevent something like this from going forward, but we're not going to let that go to waste, and hopefully there's something that we can still do, particularly since we have these players and we got commitments from those specific people. But feel free to raise your other issue, Betty.
Yes, okay. So some of you know, some of you don't know, I'm a member of BSWAB, which is Brooklyn Solid Waste Advisory Board. Sounds so interesting. Anyway, it's a board that recommends to the borough president, of course, we have a new borough president, about policy issues and concerns related to solid waste, which isn't just organics or composting. It has to do with recycling and materials. It has to do with the commercial waste zones, the emissions that the trucks emit, and many of the other health issues. So I know that someone from BSWAP, I know that we contacted the office and wanted to give a formal presentation. I don't know when that will be scheduled, you know, to your committee based on what your committee wants to hear, of course. And we wanted the presentation to be a little bit about what we do, the issues we're concerned with, but also to hear what do you guys like on the ground? What do you see as issues? What would you like to work on? What would you like, so that it's more of a dialogue? We don't want to just present stuff that we're doing because, you know, we're all of Brooklyn. Different areas have different concerns. In one area, we found out that the councilman said, don't do composting, that it's not environmentally sound. So there's a lot of different things, but we want to focus on what does CB2 see as the needs. We know that NYCHA has a lot of doesn't really have the infrastructure for good recycling and so on. So there are many issues, but we want to also hear, from you guys. So I'm your liaison to that stream of information and waste and bioswales and all of that stuff.
Right.
Thank you.
No, thank you, Betty. And I anxious to work with you on that issue, particularly around the composting. I read in the paper that if we're going to really address composting, it may be controversial, but we may have to think about mandatory composting at some point in the future,
Well,
which
that's
is a
what we've
real
been
issue.
Totally.
All
That's
right.
what we've been
So
advocating.
what can I have some further conversations about that?
Absolutely.
Mr. Varela, you had a point you wanted to raise?
Well, I'd also like to add that, in our very small 5-unit co-op here in Brooklyn, we have been the ones holding down the compost bin. And, it means a lot to us. And the short time that we live in Seattle and, just other places around the country where it is a part of life, it's not like this hard sell that it is here. And there are all the reasons and the excuses. And I understand them because those bins get pretty gross. And then there are rats. And then, I just think there needs to be more education and more facilitation around how to manage these bins so that people will be more inclined to use them, because I feel very strongly that we should be using them. I'm also very put off by what happens when, when it gets warm and when the bag breaks and all the grossness that happens. So that was just piggybacking off of that. But Betty, while you're here, I also wonder if down the road we can talk about the importance of getting more social workers into the schools and how that relates to mental health. I've been volunteering a lot at PS20 when my kids go to school. I'm there every day for recess because there were, at the beginning of this year, there were a lot of fights happening, more than usual. I wouldn't say a lot, but it was getting a little bit scary out there, for some kids. And I think the staff was overwhelmed. Some people didn't get vaccinated and left, so there were fewer paras around, and then there were lots of kids who, haven't been in the social environment for a year and a half, and so there was a learning curve there. But I realized that while I was there, how important it is to just have more humans there to redirect energy and to engage kids. And I'm saying obvious things. And then I learned that we have one social worker that works at 3 schools. And so we get 1.5 days of a social worker per week. And that person spends most of their time filling out paperwork. And no, I don't want to be anti school safety officers because they're part of our community here too. Although I distinguish that from cops in schools. But we have many of those and one social worker. And I just, it's turning the logic upside down about how to really help children deal with issues and all of the issues that they deal with in their lives. Anyway, so I would like to be a part of how to promote more social workers. And I was told recently that it's not even about the funding, it's about just the workforce. If there aren't enough social workers out there right now to come into the schools. I don't know if that's true or not, but I'd like to explore that. And then going back to what Brandon said earlier about reducing, about the environment, and I don't remember what you said exactly, but the teeth that we have as a committee, I think, and they're really baby teeth, is we can promote plant-based menus here, plant-based food menus here. And I don't mean that like we make it a condition, but in the same way, I think we have had an impact, and I'm seeing it over the last 12 years on hiring in our community, right? I still see restaurants and clientele that don't reflect the community, but I'm seeing a lot more people of color, in particular Latino and Black workers in restaurants, front of house, not just hidden in the kitchen. And I don't think we should take all the credit for that, but I really do think there's been a little bit of a cultural shift here. We are the portal for all liquor licenses. And so anyway, in that same way, I think we can be pushing more plant-based food options, on
that's
menus.
a fair point.
And I don't think we need to make that that they have to do it, but why not use this little mini pulpit that we have to push more vegan and vegetarian options?
Well,
Anyway.
those are good points. Thank you, Alejandro. Is there
Can
anyone?
I ask him a question?
This will be the final point, Betty.
Plant-based. Do you mean in schools or in restaurants? Because,
I meant in restaurants, but I'm not opposed to schools and
okay,
plant-based.
because there's
yeah.
a whole movement about that. Okay. And if you want to talk about school food and all of that, we can help coordinate that. So, yeah.
Okay, let's talk.
That would be wonderful. Great. All right. What's up next on the agenda? A motion to adjourn. Does anyone have a motion to adjourn?
Wait, Brandon, sorry, really quick. I know I'm taking up a lot of space here. I brought up the issue of reparations before, and I just want to say that I was very inarticulate about it, but I will look into it. I do want to talk about it more. I didn't mean to be flippant or.
You're going to get that opportunity. Well,
I know, but
I'm
I
all
just think
for it.
I really do think it's kind of the issue of our times as it concerns racial justice, and it's past due. And I didn't mean to bring it up in a kind of flippant, unrehearsed way, because I think that can come across as disrespectful, and I didn't mean to be. And I will give it some more thought and come back in a more
Totally fine.
in a better way.
This is the time to have an unrehearsed approach to things. We want to be fully rehearsed and pro by June. So thank you for that, Alejandro. Now I'll take a motion to adjourn.
Before you do, Mr. Smith, I just have one headline for you, which is that many Black universities yesterday received bomb threats and had to be evacuated. And the other item that I just sent to you in Caroline is that Governor Hochul just, I believe, signed legislation that will allow bars and Chuck E. Cheese's to sell alcohol on the go. That's it.
Okay, well, thank you for that. Alcohol on the go, that at Chuck E. Cheese, that I don't know what to say about that. That doesn't.
Well, it's like the alcohol to go. Like it's the thing that was from earlier in the.
Oh, yes, yeah, from during the pandemic. Got you.
I just like to tie it all in together.
Right. I will look at your email about those things, John, and thank you for raising them. Barry, are you raising your motion to adjourn?
Well, I was going to make another comment, but if you want me to just do that, I'll make the motion. I just want to give credit to a movie we saw this past weekend called Don't Look Up.
Yeah.
And if anyone hasn't seen it, give it a try. It's frightening. It's right on
great.
It's right on point in terms of almost everything we're talking about that we're struggling to try to make better.
Okay.
And, it's a great movie. And I make a motion to adjourn.
Right. I was going to say you intended to do it. Second.
I'll second, and also happy birthday, Brandon.
Oh, thank you, everybody.
Happy
birthday.
Is it today, Brandon?
It is.
It
yes.
is. Oh, happy birthday.
All right.
Mine is on
wonderful.
Saturday.
Yay.
Well, happy birthday to you, Nicole, and